Spoilers for A Knight of the Seven Kingdoms. While the injury in this scene is exaggerated and played out for dramatic effect, this kind of injury is very real. In the climax of episode 5, Prince Baylor takes a mace strike to the back of his helmet in the very end of Sir Duncan's Trial of Seven. After the fight, Prince Baylor requests help removing his helmet, which is something you should not do when you know there is a head injury, such as with a motorcycle or sports accident. Of course, there is no reason the characters would know better, and he certainly would have died from his injury regardless. Nevertheless, the only reason you should ever take a helmet off with a traumatic brain injury outside of an OR would be if there is another immediate life threat, like a compromised airway or cardiac arrest, where the helmet would interfere with rendering aid, such as CPR, giving breaths, or intubation. The primary reason that you would want to keep the helmet in place is to prevent secondary injuries, especially to the C-spine, caused by trying to remove the helmet. And with rear impacts, there is a high likelihood of spinal injury. In addition, the helmet can actually help to stabilize the head and skull fragments, which could be disturbed during the removal, causing further damage and bleeding. With a less dramatic TBI, secondary brain injury from swelling and bleeding can take time to occur as pressure inside the head builds up. In this case, such a severe head injury should be immediately fatal. However, many traumatic brain injuries can exist without such obvious external signs, so things like damage to the helmet and patient symptoms can clue you into a TBI. But also, a lack of damage to the helmet does not rule out a brain injury, so always err on the side of caution. But if you're interested in knowing what this injury realistically would look like, then drop a sub and a comment for part 2.